Frank Nelson has a background as a skilled nursing administrator. He learned the complexities of Medicare after 17 years and left the for-profit world to join the nonprofit statewide program of HICAP, which is the Medicare Health Insurance Counseling and Advocacy Program. That's what HICAP stands for, where he oversees the program that serves 6 counties of the North Bay region in partnership with the agencies, the area agencies on aging. Those are great resources, HICAP and the area agencies on aging, and the California Department of Aging. North Bay HICAP serves as a key resource of unbiased face-to-face guidance and community education seminars concerning the increasingly complicated Medicare choices. So thank you very much, Frank, and welcome.
Thank you so much, Doris. Well, give me just a moment here to share my screen. I will pull this piece up and give me just one moment. There we go. Okay. Can everybody, Doris, I'll have you be my person. Can you see the presentation okay?
Yes, I can.
All right, very good. Well, welcome everyone. You know, as Doris mentioned, HICAP, the Medicare Counseling and Advocacy Program, is a program that many times people are not as familiar with, even though if you recognize this book, the Medicare and You book, that's us on the back. And HICAP has been around since 1986, quite a while. And there are 2 things that HICAP does. One is individual one-on-one counseling. So nationally, the program is called the SHIP program, the State Health Insurance Assistance Program. But of course, California renames everything. Medicaid in California is called HICAP, or excuse me, it's called Medi-Cal. The SHIP program in California is called HICAP. And the SHIP services are available in every state, every county, so a person can sit down one-on-one with a counselor in the community they live in to get help with this thing called Medicare. The other thing HICAP does is exactly what we're doing today. Of course, today I've tailored a presentation for you, but HICAP holds educational seminars in different communities because our region of the state is 6 counties. We're holding about 13 seminars a month at various locations, some via Zoom, but just know that you can get help from a truly unbiased source, because as we talk about Medicare, the challenge is coming into Medicare and going, what is this thing, as you see there on the board? And as you have it explained to you, or you try and read through this book, which is a great sleep aid if you have insomnia, and you read some things or you hear some things, and you're like, are you kidding? What? And of course, the other thing is later on, if you're not educated, because after all, whose responsibility is your healthcare? And we know that with federal anything, it's a complicated situation. Taxes, Social Security, Medicare is no different. And too often people say, well, I had no idea. Well, unfortunately, Medicare doesn't make allowances just because you didn't know. And of course, the last piece is, as we get into some things, what may cross your mind is, seriously? Well, we're going to address some of that today as we talk about Medicare, and then I'm going to get into some of your questions. So if you would like to put some questions in the chat, as I get to the end, I will be looking at that and maybe answer a few of them as time allows. Now, obviously, a person becomes eligible for Medicare when they turn 65, or have been receiving disability for 24 months, or have some disease, specific disease processes of Lou Gehrig's or end-stage renal disease. Then they are eligible to have Medicare as their health care. Now, there's a very important concept to understand here. The answer to every Medicare question is, it depends. Because I mean, I'll use the example of taxes. Well, how much will I pay next year? Well, it depends. Are you single? Are you married? Do you have dependents? Are you doing a full schedule C? Are you a private? It depends. So when a person is eligible for Medicare, do they have to take Medicare? Well, it depends. Well, what if I'm working? Well, then what happens? Well, it depends. And I'm going to talk about some of those things in the time that we have. But I do want to go through some of the parts of Medicare as a refresher to you, or maybe for some of you, something new as you're looking at Medicare, considering Medicare, or someone you know is on Medicare. So of course, a person becomes eligible, and for most of us, we see deductions from our paycheck to Medicare. So when someone becomes eligible, those contributions, as long as they've had 10 years or 40 quarters of contributions from their paychecks, then Part A has no monthly premium. Now, you notice Part A is your inpatient coverage. So think about it. When you have a medical situation, there's a bill, quite a large bill, and those costs are parsed out to different parts of your Medicare for payment related to what it is. So when you're admitted inpatient into the hospital, inpatient in skilled nursing for rehab, inpatient hospice end of life, and blood transfusions, a portion of that inpatient of that bill is sent to the inpatient part as you are admitted into those facilities. Now, as I mentioned, this part has no monthly premium for most people. The important takeaway is, well, it depends. If you're high income, and they do a 2-year look back, then you may have what's called an income-related monthly adjustment amount, an IRMA, that's added on top of your premium. Now, that's for B and D, but Part A, for people who don't have enough contributions, may cost them a monthly premium for that part. But for most people, there's no monthly premium, but there is a deductible. And the Part A inpatient deductible, what you pay before insurance starts to pay, is $1,600. Now, that's not per year, that's per what's called benefit period. I won't go into detail, but just know in a bad medical year, you could have that Part A deductible several times. And Part A also has copays. So cumulatively, if a person is in the hospital for 60 days, starting day 61, they have a daily copay. When they're in skilled nursing, starting day 21, they have a daily copay. So Part A, your inpatient coverage, has no monthly premium, but it does have a deductible, and it does have copays after certain timeframes. Now, Part B is your outpatient coverage. This year, the premium for everyone is $164.90 a month. Unless you're high income, in which case you have that income-related adjustment amount added onto your Part B premium. And depending on a specific line of your tax return, the modified adjusted gross income, that amount determines whether you have an IRMA or not. And if you don't, well, your premium is that, although if a person is low income, they can qualify for assistance to get help with the Part B outpatient monthly premium of $164.90. Now, the majority of a Medicare bill, a medical situation, relates to this part. So the ambulance, the doctors, the surgeons, the medical equipment, all of the rehab, all of those pieces are Part B charges. The important thing to understand is Part B only covers 80% of those charges, only 80% of that $4,000 ambulance ride, only 80% of that $170,000 heart attack. It also has a deductible of $226, but the Part B deductible is per year. Now, these two parts, the inpatient coverage and outpatient coverage, is your Medicare. Now, it's not a complete healthcare package, and we'll talk about that in a moment, but I do want to move on to the situation that a lot of you might find yourself, which is if you're still working. So often we have people set appointments with HICAP. And incidentally, if you want to set an appointment, if you're in the North Bay region of Marin, Sonoma, Lake, Mendocino, Napa, or Solano, specifically Mendocino, you can go onto our website, SASNB, as in North Bay.org, SASNB.org, click on the HICAP page, and there's an orange button, and you can make an appointment there. Figure out which date, which time, kind of like getting an appointment for your hairdresser. At any rate, when a person turns 65, they're eligible for Medicare, but maybe they're still working. And if they're still working and they have coverage through their employee group health plan, then they might be able to defer, set aside enrolling in Medicare until they stop actively working 2, 3, 4 years later. But there are some important things to consider before someone takes advice like that. Now, again, as technical experts in Medicare, there are a lot of details. And as Medicare, as HICAP, we're aware of those details. And so often, even Social Security says, well, Part A costs nothing. Just go ahead and enroll. It's free, even if you keep working. One of the first things to consider is, do you contribute to a health savings account? Because if you do, and you want to continue receiving those contributions from your employer or the contributions you make, then don't enroll in Part A. Don't enroll in any part of Medicare until you stop actively working. If you do, you must stop those contributions 6 months before you stop working, or else there are tax ramifications. The next piece of the puzzle is your employee group health plan, EGHP, creditable? In other words, will Medicare give it credit for being equal to or greater than what's provided by your employer group health plan? Because some plans are not creditable, and the person will get bad advice and just decide to defer enrolling in Medicare only 3 years later to realize Medicare isn't going to give them credit for the coverage they had through their employer, and now they've got 4 years worth of penalties. And the actionable word and the important thing is you can defer Medicare until you stop actively working. Even though you get COBRA, you're not working when you have COBRA. Even though you may have a retiree plan that grants you a golden umbrella of benefits being paid for a couple of years, you're not actively working. So important things to consider if a person turns 65, is still working, still has healthcare coverage through an employee group health plan, there are options that they can choose to not enroll in Medicare. Or the flip side is maybe enrolling in Medicare is less expensive than the hundreds of dollars it's costing you for your employee group health plan. A financial consideration. Things to consider. So when we look at a decision to make, you've enrolled in Part A and B, whether you've turned 65 and you decided to enroll in Medicare, or after you stop actively working, you enroll in Part A and B, then you have a decision to make. Which way do you want your Medicare? One way, you see there on the left, is called Original Medicare, in which you would add a separate standalone Part D drug plan to your Medicare, your A and B. And also you would add a product called a Medigap plan, a product that covers the deductibles, coinsurance, and copays that I mentioned related to Parts A and B. That's what that Medigap supplemental product does, is pays those parts that you would otherwise have to pay out of pocket. And it's a product sold by insurance agents and companies. And in choosing to have your Medicare this way, as original Medicare with 4 separate individual parts, you would have the flexibility to go anywhere in the country to get whatever treatment you needed. If there was a good surgeon in San Diego for your particular condition, go get the surgery in San Diego. There are no networks. There's no pre-approval, no pre-authorization. If your doctor says you need it and Medicare covers it, you go to any provider that accepts Medicare and done deal. Now, on the flip side, you can instead choose to have your Medicare through what's called an Advantage plan. It's a managed care plan, and the way it works is you assign them your Medicare, your A and B. Medicare pays them a flat rate for you every month, and then if and when you have a Medicare situation, Medicare says, don't talk to us, you joined them, we paid them, they're in charge of your Medicare. Now, having your Medicare that way is structured as HMOs, health maintenance organizations, or PPOs, preferred provider organizations. And as such, they are in charge of your healthcare. You have to use their doctors, their clinics, there's pre-approval, there's pre-authorization. They are managing your care. So your doctor has to ask for permission to send you to the specialist, who has to ask permission to send you for x-rays, who has to ask permission to for an MRI, who has to ask permission. And if they say no, or they say not that treatment, let's give you a different treatment, well, then that's your answer, because an Advantage plan is in charge of your Medicare. Now, of course, there are benefits to an Advantage plan. You get extra benefits like a gym membership. You might get pet care. You might get meals after surgery delivered to your house. You may get pest control. You may get all these extra things. But just know, when it comes to the care and your treatment, you have this middleman that is responsible and managing all those pieces. So the decision is, which way do you want your Medicare? And once you make that decision, then we look at original. And as I mentioned, let's talk briefly about Part D, the drug part. Every year, here's another important piece. Remember I said the answer to every Medicare question is, it depends? Here's another important piece. Every year, everything changes. Every year, everything changes. Premiums change, deductibles change. When it comes to drug plans, companies change, the number of plans, the premiums, the formularies, the prescriptions that they approve. So this year for Part D, there are 26 drug plans ranging in price from $4.50 all the way up to $160.20 a month. The average is about $35, but each of these 26 plans does not cover every pill. So for this part, the plan you choose depends on what pills you're on, because every pill has a different negotiated price, and not every plan covers every pill. And further, every plan has a different negotiated copay with each pharmacy down the street. So even though you and I are on the same pill and we're on the same plan, if you go pick yours up at one pharmacy and I go pick mine up at another, we may be paying hundreds of dollars apart when we compare notes at the end of the year, simply because of the pharmacy we picked up our prescriptions at. Now, every year this part changes, and the time frame to review is October 15 through December 7. That's your chance to do a search or have HICAP do a search. We're glad to provide that service, and we do hundreds of them during that October 15 through December 7 annual election period, to at least review whether your prescriptions will still be covered and whether there's a plan that's less expensive for your pills. Now, with the Medigap piece, It's a product like life insurance, car insurance, home insurance, Medigap insurance, sold by insurance agents. There are 29 companies selling 10 plans. Every year those change too. The prices are not published. The HICAP is exclusive access to find out prices. And once again, as a person wants to figure out which Medigap plan is or company is the least expensive, go to our website. One of the green buttons is a Medigap plan search. And the time frame for this piece every year to review is your birthday plus 60 days. Different time frame than the Part D. So Part D is October 15 through December 7. The Medigap is your birthday plus 60 days. And this is original Medicare. It may cost $300 and some a month, but you have the flexibility to go anywhere you want and you don't see any more charges. If on the other hand, you have it through an Advantage plan, you have copays everywhere you go. Copay to see the doctor and the specialist and an x-ray and lab work and here and there. Yes, it's capped, but the caps are several $1,000s. And it's not until you spend the maximum out of pocket, depending on what plan, that you have no more copays. So where monthly, important word, where monthly Advantage plans are less expensive, as you get sick, that sales pitch by the insurance salesman who receives a healthy commission to enroll you in the one plan they represent no longer holds water as you start saying, well, wait a minute, yeah, it was less expensive monthly, but boy, all the copays I've had to pay because it's been a bad medical year, it's a whole lot more than I understood. Now, a third piece, and I understand that your county that you work for does not have retiree health benefits. Many of the others do that I've talked with. For instance, Marin, they have their own Advantage plans they've negotiated, their own Medigap plans that they've negotiated for their retirees. But the important part is, if that's the case and you have access to retiree benefits, you don't want to enroll in the benefits like everybody else who's not a retiree, because you could potentially forfeit your whole retiree package. Now, I know in your case, that's not the case. So you would enroll in either original Medicare or an Advantage plan. And once again, that October 15 through December 7 timeline is when you can review what Advantage plans are available and make a decision of what's best for your health and what's best for your pocketbook in deciding your best option. Now, like I said, an important date to remember, to review, if you have original Medicare, to review the drug part every year, and also review if you want to switch from original to an Advantage plan, from one Advantage plan to a different Advantage plan, or from Advantage back to original. This is the time frame to do it. And of course, our program is glad to help because we are truly unbiased. We don't sell anything. We're paid by your tax dollars with grant funding through the California Department of Aging, through the local area agencies on aging that fund the individual HICAP programs spread throughout the state. And on the left-hand side, you see a snapshot of the 5 green buttons. So if you want a Part D drug plan search or a Medigap search, or see what seminars are coming up as educational learning, or you need some Medicare details, you lost your card, you wonder how to enroll in certain things, that resources tab is there. And of course, there's our website, sasnb.org, that you can access to make an appointment. You see the orange button there, and I have a radio show twice a month, all sorts of things on that website as a resource. Of course, our counselors are volunteers. Interestingly enough, with a 6-county region and only 5 paid staff, Our 30+ counselors are spread throughout the 6 counties. And if this has been helpful, then you may consider, perhaps once you retire, becoming a volunteer and certified as a HICAP counselor. You know, people are so grateful for the help they get. And as a retired individual who enjoys the challenge, enjoys learning, enjoys very in-depth, it's the opportunity to truly make a difference, stay engaged on detailed topics as a technical expert, if that sounds appealing to you. Again, more on our website if you're interested. So with that, I would be glad to look at some of the questions. I see there's several. And Doris, I know we are crunched for time here. I did the fast
Not a problem.
fly through.
We'll go ahead and take these questions, Frank. We really appreciate it. And this is an important topic. So if we use
Okay.
up part of our break to answer these questions, so be it. Would you like me to read them off to you, or would you like to read them off the screen?
No, I will read them off the screen in the essence of time and getting through some. I might be able to do a bit abbreviated. So, Mr. Anonymous, Mr. or Miss Anonymous, what are the advantages and disadvantages of deferring Part A and B if you're still working? Well, the advantage of deferring is, of course, if you have health coverage through your work, and it's good coverage that covers you. Again, to look through the lens of these 2 components, your health and your pocketbook. If you have employee group health plan coverage and it's good for your health and it makes sense for your pocketbook, why would you enroll in Medicare to then have duplicate expenses of several $100s? So you would defer. Now, if on the other hand, your employee group health plan is not meeting your health needs, or it's real expensive, and Medicare would do a better job at meeting your health needs and be less expensive, then that's why you would instead drop your employee group health plan. And even though you're still working, enroll in Medicare as a decision. What if you retire in the next few months? Can you get the original Medicare with Part D and Medigap? Yes. I didn't have time to go into the protections, a period of time called guaranteed issue that you need to be aware of to purchase a Medigap with no review of pre-existing conditions. That's a whole separate topic. But yes, you can get original Medicare and Part D, that if that's your choice and not an Advantage plan, absolutely. October through December is open enrollment. What are you expected to, and you are expected to sign up 3 months before your 65th birthday in July? How does that work? So turn 65 in July. The rule says you have an initial enrollment period, 3 months before the month of your birthday, the month of your birthday, and 3 months after, a 7-month window to enroll in Medicare. Now, don't procrastinate. So line up all the things. Line up enrolling in A and B, then decide which way do you want your Medicare. If it's original, have HICAP do a Part D search so you know which Part D plan you'd enroll in. Have HICAP do a search of the Medigap plan so you know which Medigap plan. You call those up, you say, my birthday's July. So effective July 1st, you would have Medicare as your health care. Now, if you procrastinate, starting month 8, you're gonna have to wait a whole nother year to enroll in those pieces. So don't procrastinate. So your birthday is in July, your benefits would start. Annual election period, when everything changes for the next year, you would need to review what's changing for next year to decide what's best for your health and best for your pocketbook. Because realize whatever Medicare you're enrolled in is only good for the current calendar year. So as they're publishing what's changing for next year, you for sure want to double check that you have what you need for your health and your pocketbook, and not go, what I have is fine this year. You may be in for a rude awakening. And sadly, we get people who go, well, 3 of my 10 medications are no longer covered. I don't have the $220 to fill the prescription every month. Or, other details. do the search during that time. Can you show the slide that said beware of choosing original, that said beware of choosing original Medicare? Well, there isn't a beware, it's more an understanding of what is best for your health and best for your pocketbook. For some people, choosing an Advantage plan is less expensive, and because they don't have a lot of health issues, having limited but to certain networks of doctors, limited to your county, might be an option. If instead you have medical things going on and they say the only doctor is in Petaluma and you're in Mendocino County, then the only doctor is in Petaluma and you've got to drive there once a week for your treatments. Or, you know, again, it depends. How does Medicare vary between states? It doesn't. Medicare A and B does not vary between states. It's a federal program. D is a component, the drug part is a component of every state, although each state manages those companies that choose to contract. And the Medigap is an insurance product, so it is managed differently by each state's Department of Insurance and their insurance commissioner. So if you're moving to a different state, you for sure want to set an appointment with the SHIP program, the HICAP, there to find out, so what's different in this area as I move from California to Wisconsin, to even San Diego. Medigap plans are different. Advantage plans for sure are different. So the SHIP program is truly going to be able to help you. Doris?
Hey, Frank, I just want to let you know we only have about 3 minutes left because we're running through our break time. And
okay.
So we have a couple of questions left. Maybe we can wrap those up.
Sure, not a problem. So will Advantage plans cover travel? They say they do, but it's very limited. So be careful. Read the fine print. Thank you, Sherry. Leif, I was told that you had to sign up for AB before you turn 65, and I did. I'm still working, so I did not sign up for Part B. Is that correct? That's correct. Now, if you're contributing to a health savings account, you can't anymore and you shouldn't have. But if that's not the case, there's no downside to enrolling in A. Yes, Part B can be paid quarterly or monthly. You set it up. Do we sign up for Medicare at 64 and 10 months? Well, you make your decisions and you're eligible in that time frame to make the decisions, but you can't get your Medicare before you're 65. Retired veteran, whole different ball game, because you have options other people don't as a veteran. Can I enroll in just Part A and defer B? Yes, you can, but there are things to consider that I shared with you. So set an appointment with a HICAP counselor. We're always glad to help. And you know where to find us online, sasnb.org. There you go, Doris.
Thank you, Frank. That was a lot of really good information. We greatly appreciate it.
Sure.
I send folks over to the agencies on aging all the time because it doesn't matter what state I've worked in, they do such a great job. So we really appreciate the services you provide. Thank you so much.
All right. Take care, everyone.